this panel will give us concrete examples of community engaged research projects that have been successful, whether they are completed or it's still an ongoing story. So they're going to be able to give us some actual ideas about how their relationships got started, how their projects have moved forward, whether they're in completion, which some of those that are completed will share about, and if they're still ongoing, still sharing about how those relationships are still being maintained and how the work is continuing forward. So this is also another opportunity as a panel for them, one, to share, but also for you all to have some discussion and dialogue about how they were able to do this together. What were some of those things that maybe they ran into as pitfalls or lessons learned, or what were the key successes of what they're doing? So again, I'll let them introduce themselves. Welcome. Thank you for being here. And then you guys can talk a little bit, introduce yourselves, talk a little bit about your project, just an overview, so folks know what your work is together. And then from there, we'll start taking questions from the audience, and if there are none, as you all know, I have a few prepared. All right, great. Thank you.
How do you want to handle as a community partner in Zoom?
Oh, yes. So after you introduce yourself, we'll go ahead and have your community partner introduce herself. Okay. It's
Mallory Haas. Yeah, she's there.
okay, perfect. Mallory, if you could turn your camera on so we could be able to see you.
Yes. Let's see. Okay.
Okay, I'm gonna have your partner start first, and then we'll have you introduce yourself. Go ahead.
Hi, everyone. I'm Rochelle Hoffman. I'm an assistant professor at Creighton University, and my community partner is joining us via Zoom today. I'm Mallory Haas, and I'll talk a little bit about our project and then let her introduce herself as well after that. But the project that I had funded, so as a plug for you got the handout for applications that are due, my project was funded by the Capacity Development Award. And this project really focused on developing that community partnership. So I had a community partner potentially identified to go in and ask questions. Our project was focused on a walking program and what the community thought about this walking program to improve physical activity for those that have mild cognitive impairment, as well as their care partners. So we wanted feedback on this program. Do we think that this could work in a rural community in Nebraska? And what the project involved in was creating 3 different focus groups. So one was a team of medical providers, one was some community dwelling older adults, and the last one was care partners for folks that had a mild cognitive impairment. So getting information from all of them on what they thought about this program and potential partnership opportunities in the rural area in Nebraska. And I'll let Mallory introduce herself here next, and kind of her participation in what she did with that project. Go ahead, Mallory.
Hi. Yeah, my name is Mallory Haas, and I am a physician associate at Family Medical Specialties in Holdridge, Nebraska. We're a family practice clinic, but I primarily see patients, geriatric patients. So majority of my patient population kind of fit the clientele that Rochelle was looking for in terms of mild cognitive impairment, and some of these patients really would benefit from the physical activity. And we are a rural community, and so have a lot of community members that are really invested in improving physical activity, and specifically in this patient population. So.
Hi, I'm Kaylee Snyder. I'm an assistant professor here at UNO in public health over in the School of Health and Kinesiology. And the project that we had a community action partnership grant for was looking at the feasibility of using doulas in a home visiting program that was designed to reduce perinatal depressive symptoms among birthing parents. So this was an evidence-based program that already had a lot of literature around it, demonstrating its effectiveness at reducing those depressive symptoms, but it had been used with home visitors and nurses and clinicians, and never focused on utilizing doulas. So I partnered with the Omaha Better Birth Project and A Mother's Love to train doulas in the community to actually be able to provide the training to other doulas. And then we conducted, and are continuing to conduct a feasibility study looking at if it works using doulas with this evidence-based program.
Hi, my name is Cheryl Bessler. I'm an associate professor in the College of Public Health at UNMC. And I'm sitting here next to my community partner, Omaha Bridges Out of Poverty. And our project was trying to validate what they had been hearing from participants in this program. That not only did they improve their financial situation, but also greatly improve their well-being. And so there's a handout in the packet that shows some of the results we had. We collected a lot of data, which was quite a burden on our nonprofit here, who's got limited resources and time. But I have to say, Carl did a fabulous job, and I can't say I could not have a better community partner. So, okay, Carl.
All right, hello, good morning. Yes, I'm Carl Jackson, Director of Life Skills Coaching for Omaha Bridges Out of Poverty. Our program, an 8 to 10 week program to help individuals to understand building personal and community resources, helping them to learn how to do that. And then as life skills coaches, we stick with them throughout forever to help them to plan goals, achieve success, to achieve quality of life. And so, yeah, I work with Cheryl to collect data. I spent most of my time talking with the individuals. We build long-term relationships with everybody who enters our program. And so I was the one who should be meeting with individuals, talking about collecting data, talking about how they feel about their stress levels, and to help them to complete the scales that we brought in, the assessments.
Thank you. Are there any questions anybody wants to kick off? And anyone online as well, if there's any questions. I have no fear, I have one. Okay, I heard the two of you, Dr. Jackson and Bessler, talk about the data collection and how extensive it was and how much it was. Can you talk a little bit about how your partnership, like what you talked through, how did you decide who would do what, given the limited resources from the partner, so that way, like you said, it wasn't so much of a burden, but manageable. So can you talk a little bit about that?
Yes, I think Carl's the best person to talk about the burden, but well, when we first started designing the study, we were thinking about what we wanted to measure. So a lot of it was just based on what participants in the program had been telling Carl and others about what kind of factors were affected by reducing their poverty. We learned that they were saying they had less stress, that they were sleeping better, that their overall well-being had been improved. And so looking at just what the participants were telling Bridges Out of Poverty over a number of years, then we decided what validated measures we could use. We knew we'd have a small sample size, and we ended up with like 37 who completed everything. But that's still 37 people that you're having to talk to at in orientation, and then another full assessment at the 10 weeks at the end of the program, and then another, we went out 6 months. And so not only did we collect that, but we also measured BMI, blood pressures, trying to get an idea of whether we were improving physical health as well. So yeah, it was a lot of data collection. Then we did focus groups, we did personal interviews with all the participants. So yeah, it was a lot of data collection. So we were, basically he did all of it. When we were trying to recruit people, we would have Zoom sessions. This was during COVID. And so we would get all these people on the screen and tell them about the program. And he and I would talk to them and tell them what the expectations were, what we expected that they would get out of it, how they were helping us, validate that the program just lends so much credibility to the fact that when you reduce poverty, you improve health. And so this was a matter of like showing the health disparity related to poverty directly by measured instruments. And so I will let Carl talk about how much of a burden this was.
Yeah, well, it wasn't really a burden because I already have these relationships with everybody that comes to our program. So I'm already meeting with them. We're already talking. It's just we're starting to record these things now. And so I think the hardest part was that for individuals in our community, this was not important. You know, we're as researchers, yeah, we want to know this stuff. They're like, yeah, you know, the incentive was what brought them in. You know, if you're gonna give me an incentive for some information, yes, I'll participate. We do have individuals who, you know, many of those individuals who I'm still in touch with, who are still working on those goals, who are still improving their health. But it was a lot because we did the initial collection of the BMI, blood pressure, those kind of things. We had a graduate who's a med aide who, you know, volunteered to serve as that data collection person. I guess the biggest burden was actually the CD certification. You know, when I had to certify for the IRB so I could collect this data, you know, that was a lot of stuff. And, you know, I'm like, I get how that can be discouraging to a lot of folks who don't already have that type of education. I mean, I earned my PhD in 2021. And so I understood the whole process. And so I was able to sit and do it. But I couldn't imagine someone who had not gone into higher education to have all of these forms to fill out and, you know, all of this information. It's like, nah, I'm not gonna do all that, you know? And so I think that the biggest burden was the conveyance of the importance of this data to everybody else as I was collecting it from them. But yeah, that initial meeting, at 10 weeks, all of the scales were done online. So I would send them the links and they would do the scales. Collecting the data was, you know, putting these numbers into spreadsheets to get to Cheryl so that she can analyze this data, you know, and I really appreciated that I didn't have to analyze the data with you. That was the fun part. But yeah, it was, it can be burdensome. It can be a lot because this was a 6-month, you know, study. We went over different data collection cycles. And so that's how we lost some people. We began with 45. We ended with 37. Many of those individuals still graduated our program. They just did not get in touch. You know, it was hard to get them to talk to me about those kind of things. I have individuals who dropped out of the research, but still call me on a regular basis. You know, so it's just the importance, trying to convey the importance of data collection, of research to individuals who just aren't into that kind of thing, you know.
I will say they did. IRB required that he take the city certification thing, right? That all of us take every 3 years. And it's a lot for someone who's, I mean, you want your partner to be your co-PI on the grant, right? You're a partnership. But making him go through that sort of city thing that I hate doing every 3 years is really rough.
Yeah, I was gonna ask, I know they explained how their program got started. I wanted to know how you all got to your research projects, how they started, the relationships.
Yeah, so with the Omaha Better Birth Project, I was actually a board member on the nonprofit to start. Once we started doing more of this research and evaluation work together, I actually stepped down from the board because I didn't want it to be a conflict there. But I really just got to know the nonprofit, and then it was a matter of like, what's my best way to support? What skill set can I bring? And it was really kind of this research and evaluation lens. And so one of the first things we did was I just kind of got to know the programming that existed. And one of the things that Omaha Better Birth was doing that was unique was they are serving as a mediator for doulas and birthing parents in the community to create doula grants. And so they're kind of being this catalyst to pay for the doula, but also connect the doula to the birthing parents. And that was really unique to Omaha. And so I said, well, have you ever considered a process evaluation? And they're like, what's that? And so we talked about it, and I said, a lot of this data you're already collecting, you already have a lot of robust pieces in place. I can help you add a few more pieces, and we'd be able to say why this isn't working, and looking at, you know, dose delivered versus dose received, and, you know, how many grant applications are coming back, when are they most likely to come back, when does that fall off kind of happen, to start answering some of those process questions for them. And they were really interested in that and excited by it. And then I said, you know, we could publish this. And they were like, well, I never thought to do that. And so we ended up with a paper in Health Equity that the executive director of the nonprofit is the first author on that paper, which is really cool. And so it was really a matter of me being like, here's my skill set, and then here are all of yours, and here's how we can work together. And then this concept of, you know, a lot of the work they were doing, the piece that they felt like was still rising to the surface that they couldn't support, were the doulas recognizing so many of my clients have these depressive symptoms. You know, I want to be better informed on how to support them. I want to help understand my scope versus when to refer. You know, a lot of the doulas reported they had distrust in the medical community with when to refer, and they were nervous about referring their clients to things. And so that's when we pulled in this evidence-based program. And there's some really great pieces. It's all about helping to build resilience. There's role playing where they can work on how they talk to their partner about identifying their needs. And it's very much about this trusting relationship that we already know gets formed between the doula and the birthing parent. And so it felt like this really, you know, natural space for the doula to go into, but we wanted to see if it worked. And so that's when we decided, let's do this feasibility study, but let's also make sure that the community is guiding the work. So that's why instead of, say, me going into the community and giving this training, we trained doulas. We have 2 doulas from A Mother's Love that piloted the program themselves, learned the program, went through months and months of practicing the sessions with their own clients. And then we had this really beautiful training event with doulas across the Omaha metro area that came and had this 4-hour training from those doulas. So it was really just about laying the foundation, but also letting the community guide what they're interested in, and then here's how my skill set can support that.
That sounds like a fantastic project. I'll say that my project is just in the foundation stage. I grew up in a rural community, so I started out as the community partner, kind of knowing the setting, and then went on to get additional education training, became a physical therapist, got research training, and had a passion and knowledge surrounding very low-cost programming that can substantially make an impact on reducing the risk of dementia and possibly in rural populations as well. So I worked on creating this program that, with the end goal in mind of this program being delivered by community members, where it doesn't require a research team member to even deliver the program in the end. And so this project really stemmed from my knowledge going back to the community. Now, what do you all think about this program? And then the community members that we had participate in this, the plan is that some of them will move forward in the project and be an advisory board member, where they then are involved in the next stages, because our plan is that we'll recruit additional rural communities to get additional voices at the table, because when you know the resources of one rural community, you just know one rural community. The next rural community is going to be substantially different. So we need more communities at the table. But the next stage then is to have this advisory board where I'll work with them, and we'll kind of go through this circle of optimizing this program on what do we need to really change in this to move it forward. And we're working on that grant right now, where it truly is more than that partnership, where we're both working together and creating this board of multiple voices at the table. So stay tuned, I'll have more hopefully next time.
Valerie, did you want to add anything to the documentation?
I don't think so. You know, as Rochelle said, the original meeting happened where Rochelle and one of her coworkers came and presented this research project and this idea to a panel of physicians at our clinic, and as well as her meeting with, I know, a couple community members as well, just to kind of introduce the program. And I guess the only piece I'll add is, you know, since that presentation, that initial kind of thought of this project, it has allowed me to kind of build a patient list and looking for a specific patient profile, because as I mentioned, I do have a lot of patients that fit that mild cognitive impairment / dementia, population, and just really notice the need for a project like this, and involving our community members, not only in how that physical activity could impact, possible progression, but also just to kind of make some community members aware of, what to watch for. And so I've been able to speak with a couple patients and family members and care partners and spouses about, the interest in this. And I think that there could be an interest in our community. So.
Thank you. Any other questions, either online or in the room? Yes.
Thank you for your time and sharing your experiences. I actually have a twofold question. One for the community partners. What are some of the characteristics of your research partners that were really good that you would suggest us as researchers to have when we reach out to our community partners? And to the researchers, what are some of the differences in the team dynamics when you have a community partner in your team versus when you only work with researchers in higher academia?
I can start on this one. So I would say the way that you communicate with your community partners, and this was one of the tips that I had put on the handout, so key takeaways from Rural Community Engagement, is that elevator pitch, or how you pitch your idea, likely will be very different than your coworker that's a researcher down the hall that may understand the fancy terminology or the specific diagnosis you use or things that you're looking at. So how you portray your idea, I think, is something that researchers need to be mindful of. But then also, who is at the table, and realizing for the community partners, they may have different opinions, and how do you handle when they say two different things about, the same question or topic, and how you weigh those and how you collectively move forward in those dynamics. That's not unique to community partners. You have the same thing when you talk to researchers. They have different opinions about things. But I would say during my focus groups, that was interesting in balancing even the community members we had in those focus groups, where some were more vocal versus quiet, and how you get people to actually share their opinions and not be maybe intimidated by other community members. It's an art that I would say I'm not mastered by any means, but it's something to be aware of, so that you're making sure you're being comprehensive of getting the voice of the community with those folks that are at the table.
Yeah, I think that, again, it's understanding each other's strengths. And, there have been times, not even in just this project, but in other community projects where, sometimes the buy-in for like why the data collection process and whatnot is valuable can be challenging. And it's not because they don't see it as valuable, but because they have all these other pieces to do, and there's so much. They're running the show, right? And so even though like the data piece might be the most important thing in my mind, they're just, sometimes trying to keep the lights on and keep, put out the fires. And so I think trying to help make it as easy as possible to already streamline the data pieces into things they're already doing, and just like try and think through, are there ways that I can optimize what's already happening for you, has been really helpful, as opposed to coming in and saying, go do all these things. Because that's really hard, and it's not a reasonable expectation. So oftentimes what I found is the programs that I work with are already trying to answer some of the questions that I'm there to help them answer. So then I'm just trying to optimize the way that they do that, and that allows for the buy-in to happen kind of on both sides. So then maybe they will be able to follow up with a participant about a survey, or next time they see someone, they're like, hey, did you answer that call about that interview, or whatever it might be, because they're also kind of bought into the value of that piece.
My situation is a little different, because how I got into this project even is Dr. Ali Khan, who is the dean of our College of Public Health, is very just determined to do more community outreach and more community engagement. And our entire college is devoted to we need to be out there, we're public health people, we need to be out there in our communities doing what we do. And so he came to me and introduced me to Roger Howard, who was the CEO at the time that the project was funded in 2021. And our new CEO is sitting over here, Marcus Bell, who's just started in the last 6 months or so, I think. About a year. It's been a year. So I think what was most important when we first met, I first met with Roger Howard. Dr. Tom highly suggested I do that. And his vision of where he wanted to go. I think the one thing that really impressed me is he needed the research in order to take it to the next steps of what he envisioned Bridges Out of Poverty could do. Scalability, like bring it up to where it could be usable in like the healthcare setting. So he had a goal, a really lofty, high level goal as to where he wanted to go. And he knew that it would take the research to get there. And so my only job was to help him get to where he wanted to go. So just the fact that he had that framework for me as a researcher to say, this is what, this is where I want to be. How do we get there? And so as a team, we worked together and then we met Carl and we all got together many times to discuss like, what were we going to do to get to that goal? And so I think that just having a partner who had that vision, and it aligned so well with our College of Public Health vision and mission. So I think that's what really, really inspired me to keep working and keep pursuing those goals.
Do you remember the question, Carl?
Yeah,
Okay.
getting along, yeah. So I think that the authenticity, humility, meeting Cheryl and, coming into our environment, she came as just Cheryl. She didn't come as Dr. Bessler. A lot of times in academia, people are proud of their achievement. They're proud of their knowledge, and a lot of the conversations they have are kind of a contest. We're measuring who's got the most knowledge, who's the smartest, using the biggest words and all of these things. That does not work in a nonprofit community. You come in here with that, a lot of times the door will be slammed immediately. Cheryl came in as a person, sit down, we're gonna talk. What do we want to do? When she met our investigators, or that's what we call our participants in our program, when she met our investigators, she came as one of them. She came as somebody who's just an ordinary person. Hey, this is what we want to do. We want to collect some data. You guys are gonna be okay with that, focus groups we had, pizza, chicken, yeah, a lot of stuff. Just kind of being authentic, being friendly, being yourself. How do you hang out with your friends, not your professors? So that's kind of the way the community will accept you in first. And once you're in, then you can talk about data. But if you're coming in as a professor, showing up at the door as Dr. So-and-so, a lot of times the immediacy is that, okay, this person thinks they're better than me, and they're coming in here to talk down to me, and I'm not even going to get into that conversation. We're not even going to begin that. So the authenticity, the humility, just be yourself. The research project comes after the relationship is formed. So think more in terms that from the beginning of forming a relationship. We're gonna become partners, we're gonna become friends, and then we're gonna do some research. That's the best way.
I don't know if Mallory wanted to mention or Rochelle, you wanted to.
I was just gonna add something. So when we're just talking about having pizza, traveling to the community, think about those things when you're writing your grant. Put dollars towards that. It's probably not all gonna happen in one trip, multiple trips to the community. One of my focus groups that I had for my project was in a local coffee shop where they had a private space. Like, how can you really get in the community? And that was a substantial cost savings. They didn't even charge us for the room. I originally thought I was gonna have to rent out like a hotel conference room and spend hundreds of dollars. And that's where you get input from the community. I'm like, oh, let's just go to this space that everyone's gonna be more comfortable and then get their favorite caffeinated beverage on their way in. So having that conversation with folks in the community, thinking about that in advance, I highly recommend it for the teams and partnerships that you are developing.
Thank you. Mallory, did you want to mention anything?
I don't think so.
Right, and then we have somebody online that said, meet people where they are, which is
Exactly.
very true. Thank you for that. Are there other questions either online or in the room for our panelists?
So far, what is one thing that if you went back, you would do differently?
Can you repeat it?
So far, what is one thing that if you went back, you would do differently? That goes for you too, Valerie, all alone.
Yes, Carl's got it.
Yeah, so, we talk about, the number of people who completed the program. I think doing it differently, we would have started with a higher number. You know, we would have started with a larger recruiting effort. You know, when we first planned our research project, we were thinking, you know, 2 cohorts per, quarter, you know, for 4 quarters. And then, you know, we ended up with 48 people. It was a great plan. But, you know, as we started to work through even that first quarter, we were coming out of COVID. Most of our cohorts were online. We had 2 in person, and then they turned out to be very small, like one of 6 and one of 7, something like that. And so we ended up getting, for our first recruitment, we only had about 9 people, you know. And so, okay, I think we could have spread that out. After we finished that first enrollment session, then we thought about it, and okay, then the next session, we included everybody, all of the participants who were in our program, 120. And so, but we still ended up with, you know, just another 20, 30 people. But yeah, that's what we would have done different. We would have recruited harder at the start so that we would have a larger number at the end. Other than that, I think it turned out kind of like we thought it would.
Mhm. Yes, I think COVID did make a dent in our recruitment and was quite the problem. But what could you do, right?
Mm.
But I will say that we are working on writing a grant together now to pursue more funding. We're trying to go to Robert Wood Johnson Foundation, even though that's a challenge. And we also have a paper under review with our results. And I'm now working on the focus group analysis for publishing that. So I think we have enough that we can take it further, get bigger numbers, and actually show that this program works.
Yeah, I think that, so one thing I alluded to in the beginning was with the training we did with the doulas, one of the pieces we did was we brought in a reproductive health psychiatrist to kind of discuss scope of the doula's role when having conversations about perinatal depression, red flags, to try to increase comfort in feeling like, all right, this is when I know that I need, like I'm in an emergency situation, here's what I know would be a red flag to look for. Here's baby blues versus kind of true postpartum depressive symptoms. But what ended up happening in that 1 hour of our training was a lot of hands got raised and a lot of stories and testimonies and feelings came out about distrust in the medical system and experiences that a client had had when they maybe said they were having some fearful thoughts and, you know, hearing about a child being taken away from that birthing parent. And it turned into this really, I think, cathartic experience for the doulas in the room to have this conversation and share these things with this expert. But we weren't fully prepared for that, right? We were prepared to kind of have this training where the expert was there to share the information. And I think if I could do that training again, and the hope is we'll demonstrate feasibility of this program and scale it up, is to either allow for more of that open conversation or find ways to really get at where the doula's perceptions are before that training happens so that the training can be more tailored to what they want to hear, to make sure information isn't repetitive. One of the really beautiful things that came out from that was the doulas that led the training ended up having a meeting with the perinatal reproductive health department to talk about here's the things that our clients in the community are experiencing and here's what we want you to know. And then they're trying to make things better. It's not going to happen overnight, but that was kind of a trickle effect of these community relationships. And so I think trying to find perspectives of the community sooner, and trying to tailor every piece of the project to what that community's voice is and what that community wants to hear, and not just assuming based on, what my lens is and what I think they want to hear or what they should know, because there are things they already know and there might be things that I'm not even considering. And so just trying to engage those voices even sooner than we might think we need to.
Just to echo that, with my grant that funded this project, classic researcher way of doing things, you write the research grant and then you ask for a letter of support and say, does this sound like a good idea? Are you on board with this? And that's, we did the project, but looking back and what we're doing going forward is more involvement from the community with the development of those grant ideas, not does this look okay, but can we have a conversation about this? What are maybe some other questions that I should strategically have and focus group discussions that may gather additional information about programming? And what are some other strengths of you as a community partner that maybe I don't even know about that are going to be critical for this project? And I think having more of those conversations up front are hugely beneficial to really make that project then more mutually beneficial for both the researcher and the community involved.
Valerie, did you want to add, what you felt like could have been changed for your project, or what you learned and what you would have done differently?
I'll just echo onto what Rochelle said. I think that, since it's still at the very beginning stages, utilizing different professionals and community members' strengths and what they're seeing. Obviously we're seeing patients on the clinical side of things, but I think we also have a lot of community members that make our rural community a little bit unique in that we have a very involved YMCA with a lot of people there that are invested in, designing some of these specifically elderly patients, physical activity regimens. And so I think involving different community members where they might have different strengths in this particular research project would be a benefit.
Thank you. Any other questions in the room or online? Now, quiet online, so if you have any questions, please feel free to ask. I have a question for you all. So the question I'd like to ask is really about how can researchers build and maintain sustainable partnerships with community partners beyond the lifespan of the project?
I think to build these sustainable partnerships, you have to come to the table with an idea that you both really are passionate about, that you really want to solve this problem in the community or improve care in this area. Because if one of you is not passionate about it, it's probably not going to last very long. And then also thinking about if you have this project funded by a grant, that's clearly on a timeline, that time will expire. If you don't have another grant, there's not going to be funds to run it. So how can you be strategic with whatever project you are doing to make it sustainable? How can you create training so that people don't have to be paid? Is it, can it already be embedded, like for our example, can it be embedded within the YMCA that maybe their personal trainers could receive training on how to do this walking program with older adults? Or can it live within the senior center programming so that once the project is done, these things can continue on without you having to be as heavily involved as a researcher and have those funds to support it?
Yeah, I think just having the conversations around scalability and sustainability as early as possible. So recognizing, this might be 1 year of funds, but here's my plan already. If we can demonstrate that this is working, here's what I think we could do to build it up and to support you. And then, from a data perspective, recognizing that, all these metrics might not be valuable to you in the long term, but here are the ones that might be, and here's the way that I can help you be able to disseminate these yourself and continue to support you so that you can keep having this continuous improvement data coming in. So again, there's this buy-in of, okay, I can see the long-term benefits of this.
the Omaha Bridges Out of Poverty is very sustainable. They have done a great job of fundraising. They have so much support in the community. I mean, they will continue. However, getting to where they want to be, I hope to be part of the process and to help them. Because I think that if we could take this program and integrate it into healthcare systems and try to address both the poverty issues and the healthcare issues at the same time and make it more widely available to everyone, I think that's where we want to go. And so that's the issue more than just sustainability of the program itself, but expanding it and making it more utilized across the needs that are out there.
Yeah, I think it's all about relationship. Dr. Bessner Cheryl is part of our family now. And yeah, so, you know, it's just something that will continue, even if we're not doing research, you still know her. We'll invite her to our events, you know, and so, yeah, long term, I don't see her as going anywhere. If we come up with other research ideas, who we're gonna call, you know, those kind of things. It is the build a relationship and maintain it. This is not just a one-off project where you're coming in, you're gonna do some research and you're gonna go away. You know, you come in, you meet these folks, you become part of this family, and you know, the research ends, you may go away a little bit, but you got the phone number. You know, you're still keeping in touch. You're still, like I said, part of the family.
Thanks, Carl. And I'll remind you that we're still writing grants.
Yes, we're writing grants.
Mallory, do you want to add anything on that?
No.
Yeah.
I have a question, not just for you, but everybody in the room, regarding sustainability. Some of the times the idea is great, the community is on board, everything is in place, except that we don't have. I mean, the community doesn't have to sustain that program. So the question is, what are some of the ways that we can source out funds so that some of those great programs will go on? And I'll give you an example to make it more tangible. So like what you're doing with senior centers or a community just with walk. Well, walking seems, you know, pretty low cost, but still it requires somebody to organize it, somebody there to be responsible for that. I don't know, it just, there is some cost to that. And then if that is not within the budget of that community, that might just vanish. Just get smaller and smaller. So what are the ways that we can, really can we go find money that?
How do we get to the money question?
Yeah. The grant would try and initiate it, but over time, how can we sustain it?
Well, I mean, one strategy is to diversify where you're looking for those funds, right? Like I know the nonprofit that I work with, they get some funding from, you know, Medicaid supplier or Medicare suppliers, and they get some foundation grants, and they have some, you know, philanthropy happening. And that all can kind of fund their programs. So again, if we're supporting a program and you know, doing research around a program, those don't have to necessarily be research funds. But I think the other thing is, you know, to get to those research dollars, we know part of it is publishing and demonstrating impact. And so helping to make that feel more, you know, possible for community partners. Like I kind of shared with that process evaluation paper, my community partner never really even saw that on their radar. Like they never thought about publishing their work in this way, but now they have this paper where they can go to their funders and say, you know, I've looked at this from a scientific manner to demonstrate that this is working. And that holds a lot of credibility and kind of increases their ability to have conversations with those foundations and with those, you know, philanthropy organizations. And so I think continuing to find a way to disseminate the findings and pulling community partners into that in ways we don't typically, I think is valuable.
So when we're thinking about the programming we're developing, the strategy specifically was walking because we knew that it needed very minimal equipment in order to do that. So we're not requiring that, you know, if they were to decide to become a bike program, for example, or they have to have a bicycle in order to do it. So thinking about ways, how can you maybe change your program to make it less costly, I would suggest as a strategy. As well as what also is mentioned with the diversity of funds, maybe it's putting on fundraisers in the community where you get more of those philanthropic funds to support things. And I just think additionally, who are the key partners that are invested in this? Can you have volunteers really that help with this? Do they have to be paid individuals that do this programming? Do you have people that are passionate about this to do it in the long run? And it's hard. It's hard when the grants run out. And that's why thinking about sustainability before you even write the grant is tremendously important to keep it going.
Yeah, my response to her question is, it's more philosophical. It seems like we already know this, but I don't think we think about it enough, which is a nonprofit is a business. Treat it as a business. McDonald's does not close if it only has 2 employees. Those 2 employees still make burgers and still try to sell them. Commercials still run on TV, the ads are still up. It's a business. I think in any type of organization that's nonprofit, especially in research that's nonprofit, a lot of people rely on grants and say, oh, we ran out of money, sorry, the program's done. Instead of seeing it as a business. So as has been talked about multiple times, if your relationship is that important, and being able to keep your commitment to community is that important, you will treat it as if it's that important and you will treat it like a business. So even when it's rain, sleet, hail, or snow, you're still going to push forward and make it happen. So when there is no funding, you're going to diversify. You're going to also look at other opportunities. And you're also going to say, how do we keep this business afloat and make it happen? I always tell that to other organizers and individuals that want to start organizations. They say, well, we don't know how we're going to fund it. Most nonprofits, especially larger ones, get a development director. They say we're gonna hire somebody to go get the money. The same way with research project. Are you gonna find somebody that's gonna fundraise for the project, even if the project is in jeopardy of not having funding for the next however long? Most of the time, it sounds like these grants are applied for, people go for that grant and then they wait for that grant to continue to sustain itself. Rather than saying, if this grant doesn't come through, we don't get a renewal, how can we continue to do this work because it's that vitally important? Because the people have already bought into you, that's a critical step. To let those people down would be a misnomer, to be one of those traumas that we just talked about earlier. Just focusing, well, the funding's going, the program's over, research is done, here's some people who invested most of the time for free, for a couple of little stipends, and don't even get the chance to see the results of the work that they've done because somebody wasn't willing to put in enough effort to keep it going. So I say philosophically, treat it like a business and be willing to say, oh, my program's in jeopardy, we run out of funds. I'm going to make the shift that's needed.
I'll just add to that, I think what we've learned in a couple of projects that we've done is, you know, we have an advisory board for one of our projects, which was sort of tanking because we didn't have the money. And one of our advisory board members had access to some funds that we wouldn't have thought to even know about. We wouldn't have known about it if the person was on our board, which happened to be state dollars, and we went after them and we got them. So being resourceful about thinking about who, you know, it's not always what you know, it's about who you know, what kinds of access they have. So that was the one piece that we learned. The second thing I think, Haley may have brought it up about publications. While those are fantastic, we also learned that when we promoted the project through regular, everyday press releases, magazine, newspapers, we did interviews on podcasts, getting the project out there to the general public, not just our peer-reviewed public, really helped us to have the project be more visible. And that also helped us to get more money because people that have the money that are like, oh, what do I want to put my money towards? And they see about this incredible project and they're like, we want to give you money. So be thinking beyond just publishing your papers, but thinking about what interviews can you do? What newspaper articles can you put in? What newspaper articles are going to have an impact that you want, whether it's to share the findings with community in general to be excited about the work. Or if you're literally trying to fundraise, find those news outsources or news outlets that could really provide that for you. Sorry, I was slowly moving because I knew she had a question.
I'll just add to that, even us in the community where you're trying to raise awareness, if it's about a certain area, like for me, where I'm focused more on dementia and Alzheimer's disease, like certain national events that are surrounding that, where you go in the community and you put on like a fun walk or something like that, or you're drawing attention to that as well, but you're also getting to share about maybe an active project you're doing or research results at that time too. So more presence in the community is definitely critical.
Yes.
I would say one of the downfalls with that is like culturally for our community, we are one that like, we're very humble about the things that we do. So not putting out there, I think probably promoting is one of our like hardest things to say, like, these are the things we're doing, these are the people we're serving, this is the impact we're having, because the work is nonstop. We don't have time to sit here and boast about those things, like we're just doing them because they need to be done. But sustainability, and I am like one that is very honest and real in grant applications. When they ask about it, I'm like, we was doing this with $100 for 15 years. Like, this is gonna happen with or without those dollars that somebody wants to give us. But it's also like, if you don't trust us enough with that funding, then don't give it to me, because I shouldn't have to continually prove that this is doing what it should be doing. So I don't know, some people love to have me in the room and talk, and some people don't love to have me in the room and talk. But it's also like, you're gonna have to hear it one way or another. Whether you invite me back in the room is a different story. But at the end, sustainability is really like, we'll make it work. We had some funders in last night, and I've had meetings with them on Zooms and whatever, and they were like, we know you're busy. We know you tell us you're doing all these things. But to have, 40, 50 people come into a space that is not a normal night that we would be doing something like that, it would be focused on something else. And at a drop of a dime, we're willing to show up, share their experiences. And we're saying, we might have been in 7, 8 different spaces in the last 3 years, but they put in the grind, they've done the work, they hustled to get to where we're at, so that we have a space to call our own. And so that's it, is that really when you have people doing the work, they're gonna do it regardless of you want to fund them or not. But also that's where we need those partners. Because when it comes from UNO, UNMC, Department of Health and Human Services, when it's coming from you to tell people, oh, this is important, there's this conference, there's this training, it means more to the outside world coming from you than it does coming from myself. So I think, how do you help support that work? You just sharing that information and opportunities out for us makes a big difference in the funding support that we see.
Thank you. We will always invite you in the room, Nicole. You don't have to worry about that with me. Okay, I have a last question, unless there's somebody has a question in the room or online. I have one last question for the panel, and then we will take a break and get ready for lunch. Anyone? Okay, I have a question for the community partners and the researchers. So for the researchers, what advice would you give to early career researchers who are looking to incorporate community perspectives or engagement into their work? And for our community partners, what advice would you give community partners or even residents who are on the fence about getting involved in research?
I would say that it's hugely important, and I feel like in traditional research training, it's often overlooked the value of the community input in your area. You more so just look for how many publications are in that area and can I cite this, but really getting that valuable input and to not be afraid of the community too and be vulnerable with them. There may be things that we haven't gotten right, and many things that we haven't gotten right in the research world, and being able to own up to that and learn from the community on how we can improve our focus for research. So go into the unknown. That's what I felt like it was when I started this project. I did not have training in qualitative research, and so I had to strategically build my team in order to be able to analyze qualitative data as I interviewed these folks, but know how important that is and embrace it.
Yeah, I think recognizing your own limitations and your own biases and letting the community take the lead. I think to Rochelle's point, a lot of the time we look at, you know, the national picture or a program that works somewhere and we say, okay, we'll put it here. But there's a lot that we're missing when we do that. And so I always just say, like, we're community first, and the community is going to guide the work, and then I'm here to support with what I can do. But we're here to help the community, and the community is the people doing the work are the ones that need to be running the show.
Remembering back to when I was a newer researcher, my first, the first event getting into like helping communities was getting to know an organization that was helping young girls who had experienced sexual assault. And so I had a connection through my professor that I was working with, and I just connected to this nonprofit that was doing this great work to help sexual assault survivors. And so if you go in and volunteer and go, I mean, so many nonprofits need help, and there's so much we can do as researchers to support their work. So just going in there and helping them improve their programs and asking them what kind of questions they'd like to have answered. What kind of evaluation would you like to do? Would you like to write grants to get more funding? I mean, there's so much you can do to make those connections, build that experience, work with nonprofits. That's what I would recommend, and that's what I do recommend to my students who come to me and ask me, well, how do I get into working with nonprofits? Well, go volunteer with them. They will not turn down free labor. They would be happy to have you.
Yeah, that is so true. And so for community partners, it is important to just kind of realize the value of an experienced researcher. You know, the data is something that we always know. You know, you got to have your data to get your funding. You got to have data to stay sustainable in the community. But if you can bring in a researcher with you know, PhD level credentials who can really kind of take it to that next level, this actually helps you grow. This helps you to stay funded. This helps you stay alive. You know, if just for community partners to understand that even though you don't understand all of this research, you don't understand, you know, the IRB process and all of those things that go into that. If you bring this data to the table as you go ask for funding, you're more likely to get that funding. You know, if they can see that you're actually tracking what you're doing, you know, and especially to another level. We've been collecting data from the beginning. We always track everybody who's in our program to see what kind of improvements our program is having on their lives. But to be able to have another level like this healthcare piece to add on, I mean, that's just impresses even more. I mean, the board loves it, the CEO loves it, you know, and so for community partners, be open to help, be open to you know, people, if a researcher shows up at your door, yeah, I want to do a project, it's like, yes, because this could actually improve your income. This can improve your sustainability.
Thank you. And Valerie, the question was for community partners, what advice would you give to community partners or residents who are on the fence about getting involved in research?
Yeah, I know time is always a major commitment when you're working in a busy rural hospital and clinic or whatever your role is in your community to take on an extra project. But it's really the foundation of how we make the best evidence-based decisions for our patients and how that's going to positively impact not only our patients, but our community. So I just think that it needs to be the foundation, and to help in any way we can to be a part of these projects and to make some of this research and data accessible out to the rural communities of Nebraska is important.
Thank you. Well, I want to thank all of the panelists for being here with us and sharing your experiences today. Can we give a round of applause?